Hi, my name's Claire. I'm one of the grade A keepers here at Utah's Hogle Zoo. And I'm here to talk to you a little bit about how we've been doing Jabali's ultrasounds to track her pregnancy. Jabali is a first-time mom. She doesn't have any experience with babies, and so it's really important for us to keep a really close eye on her during this pregnancy to make sure everything's going smoothly. So I know we've had a lot of questions about how we do her ultrasounds and what we're looking for. And before I touch on those, I'd like to take just a few steps back just to kind of talk a little bit about how we knew Jabali was pregnant and how that process sort of goes. So we got our breeding recommendation for Jabali and Husani to breed from the gorilla species survival plan in the middle of last year. And then in August, Jabali was taken off of her birth control. And then in October is when we saw the first signs of successful breeding between Jabali and Husani. So basically the gorilla SSP recommends that you wait about a month after you see successful breeding before you start testing with just your regular human pregnancy test kits. The normal ones that you see at the grocery store are the ones that we use as well. The hormones that are in gorillas are similar enough to humans that those tests will pick up those hormones as well. So our first positive test that we were able to get on Jabali was actually on November 14th of 2019. So after that first positive pregnancy test that we got on the 14th, we ended up doing a test monthly, just like the gorilla SSP recommended. We ended up doing about 4 tests over the next 4 months. Every single one came back positive, so that was great. And then that was around the time that we started getting really great regular ultrasounds with Jabali. And at that point, because you can also confirm the pregnancy through ultrasound if you're getting regular images, we didn't need to continue testing every single month. As long as we were continuing getting those regular ultrasounds, which we were, we just kind of stopped having to test then. So we've just been continuing with the ultrasounds since December, January, and we've been doing those weekly, and every single time it's been really great. We've gotten really great images, and we've really been able to confirm a lot of good stuff with this pregnancy. So what's interesting about ultrasounds with Jabali is we actually started doing ultrasound training with her back in 2018. So our training program here at the Hogle Zoo, it's a pretty extensive program. We do a lot of really cool behaviors with these guys. And a lot of the behaviors we do are sort of planning for the future. So a lot of our guys participate in a lot of their medical care. And ultrasounds are one of those behaviors that can come in handy not only for when and if a gorilla becomes pregnant, but if we needed to do a cardiac ultrasound or any other thing like that, ultrasounds are really important and can be really helpful in their own medical care. And so we actually started training her for ultrasound back in 2018. So she was already fairly well established on this behavior when we did get this breeding recommendation from the SSP. And then once we got that first test and we were able to wait a few weeks to kind of let that baby get a little bigger so we'd actually be able to see something. And then we were able to start those ultrasounds and get regular images starting around in December. So since December, we've done 19 ultrasounds as of this morning. We did one just this morning. So we've been doing those ultrasounds weekly with her. So the ultrasounds generally, they can last anywhere from 1 minute to 10 minutes. It really all depends on Jabali and her comfort level. All the behaviors we do with these guys in our training sessions, they're totally voluntary. So Jabali is participating because she chooses to and because she gets really good treats for it. And so basically she can participate for as long as she wants, and when she starts getting antsy, maybe she's getting a little bit tired, she can walk away whenever she wants. So basically, we try and get some really good images first off, and we can really see things right away. Right when I put the probe onto her belly, I can usually see a really good image of the baby and just generally what's going on. And so generally, you know, we really see what we need to see within the first minute or two, and then anything after that is just bonus based on what Jabali's comfortable with and how long she wants to do the behavior. So when humans are getting ultrasounds when they're having their own human baby, You know, ultrasound technicians can really get a lot of really interesting images. They can move the probe all around the belly to get different angles and different images like that. With Jabali, we're really limited with just the situation that we're in. You know, we do all these ultrasounds through a protective barrier. And so we generally just do kind of straight on positioning with the probe against her abdomen. Given that, we aren't really able to get maybe as many angles or as many different types of images as maybe you would with a human pregnancy. And so we're not necessarily looking for seeing everything you might see in a human ultrasound. We're really looking for the basics. We're looking for the heartbeat, making sure that's a regular, strong heartbeat. And we're looking for maybe a little bit of movement from the baby to make sure it can kind of wiggle around and move. And as long as we see that good, strong heartbeat, we're pretty happy with that ultrasound that day. So trimesters aren't necessarily a usual term used for gorilla pregnancies as far as I've heard. Generally, the information that I've heard has been more on a monthly basis, tracking a gorilla pregnancy, or even just you know, the second half of the pregnancy, you might see these things in comparison to the first half. So I think you can easily break up a gorilla pregnancy into 3 trimesters, but because there's not a lot of data and information out there yet about tracking actual, you know, in utero growth and size of the baby, there's not any current research projects out there right now that kind of have that information available for institutions to use to compare how our pregnancy is going compared to how other institution pregnancies are going. So currently, because there's not a lot of information like that out there, generally we don't tend to use the trimester term as much, but we tend to kind of refer to the pregnancy as the first half of the pregnancy and the second half of the pregnancy. Gorilla pregnancies range from 237 days to 285 days, which on average comes around to about 8.5 months, so they can be slightly shorter than human pregnancies. So it can definitely be compared to human pregnancies, but it is slightly different. So basically how we track Jabali's pregnancy is from the first date that we observed successful copulation between Jabali and Husani, we can kind of calculate out based off of that day range of 237 to 285 days, and we can calculate out when Jabali's birth window might be based on that copulation that we saw. Generally, gorillas are fairly obvious behaviorally as far as when they're about to be ready to copulate, and so it can be relied on fairly well to kind of be able to pinpoint that window based on that copulation date. That being said, gorillas can also be very secretive, so it's kind of a give or take. So, you know, we can kind of have that date that we think that copulation occurred, and then have that general window, knowing that there may have been other copulations that occurred that we didn't see. So once we have that birth window, we can kind of guess, you know, here or there, based on when, you know, at what point in the pregnancy she might be at. And then also we can track her behavior and see if we see any behavioral changes. We can see if she's having any physical changes. A lot of those physical changes that we might see usually happen in the second half of the pregnancy, or at least after the 4th or 5th month. Sometimes you can see her belly getting bigger. That's a big one. You can see weight gain start to happen. You can see the breast or nipples start to enlarge. You can see swollen knuckles sometimes. And then you can also just see behavioral changes as well. But you also don't always see that in every single individual. Just like humans, gorillas are totally different individually. And so what happens with one female gorilla during her pregnancy might not happen with another one. And so since this is Jabali's first pregnancy, she's a first-time mom, so this is totally new for her and it's totally new for us. So we're kind of all learning as we go. So we've definitely seen some slight changes in Jabali's behavior during her pregnancy. A little bit more early on, she started just kind of leaving her carrots behind. Seemed like she may have had a little bit of a food aversion to carrots. That was kind of the main big thing that we saw. She may have been a little more tired than usual, but overall her behavior was relatively the same in the beginning of her pregnancy. Now that she's nearing the end of her pregnancy, she's definitely gotten a lot bigger. Her belly is very big. She was definitely a little bit of a smaller gorilla before. Gorillas in general do tend to have larger bellies, given that they have a little more complex digestive systems. So sometimes a gorilla can look pregnant even when they're not. But in Jabali's case, now her belly is even larger than it was before. So that's definitely been a physical change that we've seen in her. She has also just started to gain a little bit more weight. And that's also something that can happen nearing the end of the pregnancy. So we've definitely seen that. We haven't seen a ton of other things from her. We have seen a little bit of a behavioral change in these last few weeks and months, especially as far as just really wanting to be closer to her companions, wanting to make sure she knows where her mom and where Husani are a little more than before, but those are all pretty slight changes.